Hi, everyone. I'm Randy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. I'm here to provide you an update on the COVID-19 pandemic on Mobile County. We'd hoped to do our update on Facebook Live today at 2:30, but had some staff shortages, and so we're providing this recording to you instead. So I hope you find it informative, and please continue posting your questions on Facebook, and we'll try to get to them maybe in a later broadcast. So it's important for folks to know that the number of cases of COVID-19 are beginning to rise a little bit. Also, hospitalizations due to COVID-19 have been up a little bit in Mobile County. It's nothing like the record numbers that we saw in the summer, of course, but it could easily get that way. So we're just asking everyone, just please continue, particularly through the holidays where we know there are going to be a lot of gatherings and a lot of travel. Please continue to do what you can to slow transmission of COVID-19 in our community. You know, we're seeing cases up, hospitalizations up slightly. The percent positive is inching up slightly. We're starting to hear about cases of COVID-19 in long-term care facilities and other congregate settings and workplaces. And we certainly want to try to do our best to slow transmission and keep it low. Complicating things is that seasonal influenza seems to be behaving normally this year. So it is inching up. We're still not at what we would consider sort of the threshold of concern, but we are seeing an increase of doctor's visits for influenza-like illness. The Mobile County risk transmission level is still at moderate, which is good, but the state overall is seeing many counties now that are moving into the substantial and high level of transmission. So overall, Alabama they're in the substantial level of transmission due to the average number of cases added each day and the increase in the percent positivity. So just please keep a close eye on it. Enjoy your holidays. But do the things that you need to do to try to help us keep transmission here low. The big news yesterday was that the Alabama Department of Public Health released information that an Alabama resident had been diagnosed with COVID. The specimen was collected at a pharmacy. It was positive and then sequenced by a lab contracted by the Centers for Disease Control. So we were notified earlier this week, the state health officials were notified that it was an Omicron variant. And the most interesting and curious thing to me about this case is that the person reported no travel out of the state of Alabama. So that means that this patient contracted Omicron variant of COVID-19 from someone else who lived in Alabama. So that person-to-person transmission is what really concerns us. Travel-associated Omicron we would expect, but to know that there is already person-to-person transmission in the state of Alabama is an indication that, you know, we thought it was probably here, didn't know to what extent it was present in Alabama. And I expect that as we see more and more PCR specimens sequenced, we will learn that it's more widespread than we thought. Nationally, it's been estimated a couple of days ago that Omicron was perhaps 3% of the variants circulating in the United States. Others have said that, you know, within 7 days, it's going to be upwards of 15%. So everybody thinks that Omicron is going to spread very rapidly and perhaps take over the Delta variant as being the dominant strain in the United States. So stay tuned on that. So again, it's Omicron. We know that it's more highly transmissible. What we're still trying to do, what scientists are still trying to understand, is how it compares to Delta in terms of transmissibility, disease severity, you know, if therapies work against it, if testing platforms work to detect it, and if how well the vaccine works to protect you from severe complications of illness and death if you're fully vaccinated. So again, just remember, get vaccinated. Wear a mask when you're at indoor public gatherings, stay 6 feet apart from people, these things that we've been talking about for a really long time. Get tested if you have symptoms, stay at home if you have symptoms. Wash your hands frequently, stay away from crowds, improve ventilation in your home or workspace or in your school, and just take extra care to avoid the virus if you have underlying medical conditions or if you're prone to severe disease, if you get sick or if you're immunocompromised, that sort of thing. So just those layers of protection will help us slow the spread of Omicron in Alabama and in Mobile County. So expect to see more announcements of Omicron detected, but again, the first one was in an Alabama resident who lived in the West Central District, had mild illness, is doing well, isolating at home, and again, had no history of travel outside of Alabama. All right, the other big thing to maybe talk about or provide some information on is the fact that the CDC Advisory Committee on Immunization Practices considered yesterday and voted unanimously to recommend that people receive a Pfizer or Moderna vaccine over selecting a J&J vaccine. Now, this is based on a lot of factors, and it doesn't necessarily mean that Johnson & Johnson is not a good choice for some people. People that can't come back for a second shot that is required for Pfizer and Moderna, or maybe for whatever reason doesn't want to take or can't take a messenger RNA vaccine. There's still maybe instances where the Johnson & Johnson vaccine would be appropriate for someone, but ACIP and CDC are endorsing the recommendations that that people, given the current state of the pandemic and around the world, that we want you to get vaccinated. Getting vaccinated is better than not getting vaccinated, but given a choice, consider the Pfizer and Moderna vaccine over the Johnson & Johnson vaccine. I think that, Johnson & Johnson, part of the decision was that there has been some information through the Vaccine Safety Network, which is very robust, 54 cases of what's called TTS, which stands for, sorry, I've got it around here someplace, thrombosis with thrombocytopenia. So patients with a history of thrombosis with thrombocytopenia should not receive Johnson & Johnson vaccine. There were around 50 cases or so of adverse events that occurred in people who took the Johnson & Johnson vaccine. But again, it still is an extremely low risk of adverse reaction. So let me see. So far, CDC has logged 54 cases of TTS, or thrombosis with thrombocytopenia syndrome, in the US since the vaccine became available. That translates to 3.8 cases per million doses given, and the death rate is less than 1 person per million doses given. So for many people, it's still going to be a good choice. But again, if you have a history of TTS, please do not get a Johnson & Johnson vaccine. And right now, the CDC is recommending Pfizer and Moderna over Johnson & Johnson. So, I think that, the ability to detect a small signal in the vaccine safety data that we're collecting really shows the strength of our vaccine safety surveillance system, that we could detect this very small signal and slightly modify the recommendations based on this information. So hopefully the whole process, as we continue to learn more and we share more, will increase confidence in the vaccine supply and our ability to monitor safety and to make adjustments as we learn more and more about the vaccine. So TTS is an unfortunate event. We're not trying to downplay that, but still, the risk of adverse events because of getting COVID still far outweighs the risk of adverse events with vaccination. Unless you have a history of TTS, please do not get a J&J vaccine if you have that in your medical history. So I think that's all that I wanted to say. I just want to sign off today by saying congratulations to my secretary, Josie, who's retiring at the end of this month with 30 years of service to the Mobile County Health Department. She's been a huge help to me through the COVID outbreak, certainly a strong power behind the scenes helping me and the rest of the COVID team be successful. So thanks for all of your hard work, Josie. We're going to miss you. So stay safe, everybody out there. Have a great holiday. Enjoy your Christmas, your Hanukkah celebrations, your other religious celebrations. Have a great, safe new year. We'll talk to you soon.